Hello friends, welcome to our channel. In today's video, you will learn 15 about alarming signs of high blood sugar. High blood sugar, also known as hyperglycemia, can be a serious health concern. It's important to recognize the signs early so you can take action. Remember, this information is meant to educate, not to diagnose. If you notice any of these signs, it's always best to consult with a healthcare professional. Let's get started. Pay close attention, as this knowledge could make a big difference in your health or the health of someone you care about. 1. Extreme thirst. Extreme thirst, also known as polydipsia, is a common and early sign of high blood sugar. When your blood glucose levels rise, your body tries to flush out the excess sugar through urine. This increased urination leads to dehydration, triggering intense thirst. You may find yourself drinking large amounts of water or other fluids, but still feeling parched. This thirst can be relentless and difficult to satisfy. It's important to note that while drinking water is essential, it won't address the underlying issue of high blood sugar. The constant cycle of drinking and urinating can disrupt your daily life and sleep patterns. If you're experiencing extreme thirst that doesn't seem to have an obvious cause, it's better to consult a healthcare provider. They can test your blood sugar levels and determine if diabetes or another condition is the root cause. 2. Frequent urination. Frequent urination, or polyuria, often accompanies high blood sugar. As your body tries to remove excess glucose, your kidneys work overtime to filter and absorb it. When they can't keep up, this sugar is excreted into your urine, along with fluids from your tissues. This leads to more frequent trips to the bathroom, often producing larger amounts of urine than usual. You might find yourself waking up multiple times at night to urinate, disrupting your sleep. Daytime frequency can interfere with work and social activities. It's important to distinguish this from other causes of frequent urination, such as urinary tract infections or prostate issues. If you're urinating more than usual, especially if other symptoms accompany it, it's time to consult a doctor for proper evaluation and potential blood sugar testing. 3. Blurry vision. High blood sugar can significantly impact your vision, causing it to become blurry or unfocused. This occurs because excess glucose in your blood can change the shape of your eye's lens, affecting its ability to focus light correctly. The blurriness may come and go as your blood sugar levels fluctuate. You might find it difficult to read, drive, or perform tasks requiring visual acuity. Some people describe it as looking through a foggy window. This symptom can be particularly alarming as it may develop rapidly. However, it's often temporary and can improve once blood sugar levels are controlled. If you experience sudden changes in vision, seeking medical attention promptly is important. Persistent high blood sugar can lead to more severe long-term eye problems, including diabetic retinopathy, so regular eye exams are essential for those at risk of diabetes. 4. Fatigue and weakness. When your blood sugar is high, your body struggles to use glucose for energy efficiently. This can result in profound fatigue and weakness that goes beyond normal tiredness. You might feel exhausted even after a full night's sleep, or find yourself needing frequent naps. Simple tasks may seem overwhelming, and you could experience a significant drop in physical and mental energy. This fatigue is often accompanied by a general sense of malaise or feeling unwell. Your muscles may feel weak or heavy, making physical activities more challenging. Cognitive functions can also be affected, leading to difficulty concentrating or brain fog. It's important to note that while rest is important, excessive fatigue that doesn't improve with sleep could be a sign of a more serious underlying condition. If you're experiencing persistent fatigue along with other symptoms, consult a healthcare provider for proper evaluation. 5. Dry, itchy skin. High blood sugar can lead to dry, itchy skin, a condition known as xerosis. This occurs because elevated glucose levels can affect your body's ability to retain moisture, leading to dehydration at the cellular level. Your skin may feel rough, flaky, or even cracked, especially in areas prone to dryness, like elbows, feet, and hands. The itchiness can be intense and widespread, sometimes leading to scratching that can damage the skin and increase the risk of infections. You might notice that lotions provide only temporary relief. In some cases, this dryness can exacerbate existing skin conditions like eczema. It's also worth noting that persistently high blood sugar can impair circulation, further contributing to skin problems. While moisturizing can help, addressing the underlying blood sugar issue is crucial for long-term skin health. 6. Slow healing wounds. When blood sugar levels remain high, it can significantly impair your body's natural healing processes. Cuts, scrapes, or other wounds may take much longer to heal than usual. This delayed healing is due to several factors. High blood sugar can damage blood vessels, reducing blood flow to the affected area and limiting the delivery of oxygen and nutrients essential for healing. It can also weaken the immune system, making it harder for your body to fight off infections that might complicate the healing process. You might notice that even minor cuts or bruises linger for weeks. In severe cases, wounds may not heal properly, leading to chronic ulcers, particularly on the feet. This slow healing can be especially dangerous as it increases the risk of infection. If you notice any wounds that aren't healing as expected, it's important to seek medical attention promptly. 7. Unexplained weight loss. Paradoxically, high blood sugar can lead to unexplained weight loss, even if you eat the same amount or more than usual. This occurs because when your body can't use glucose properly for energy, it starts breaking down fat and muscle tissue instead. This process, known as ketosis, can result in rapid weight loss. You might notice your clothes becoming looser or see a significant drop on the scale without any intentional changes to your diet or exercise routine. This weight loss can be substantial, sometimes several pounds per week. While some people might initially welcome this change, it's important to recognize it as a potential sign of a serious health issue. Unexplained weight loss, especially when combined with increased hunger and other symptoms, should prompt immediate medical attention to rule out diabetes or other metabolic disorders. 8. Increased hunger. Excessive hunger, or polyphagia, is another common sign of high blood sugar. Despite having plenty of glucose in your bloodstream, your cells are starving for energy because they can't access it properly. This triggers intense hunger signals, leading to a constant desire to eat. You might feel ravenous shortly after meals or wake up hungry in the middle of the night. This hunger can be difficult to satisfy, leading to overeating or frequent snacking. However, consuming more food doesn't resolve the underlying issue and can further elevate blood sugar levels. This increased appetite, combined with the body's inability to use glucose effectively, can create a frustrating cycle. It's important to distinguish this type of hunger from normal appetite fluctuations. If you're experiencing persistent, extreme hunger along with other symptoms, it's time to consult a healthcare provider for evaluation. 9. Nausea and vomiting. High blood sugar can cause nausea and vomiting, which are particularly concerning symptoms as they can lead to further dehydration and electrolyte imbalances. The nausea might be constant or come in waves, often accompanied by a general feeling of unwellness. Vomiting can occur and may be severe in some cases. These symptoms can be caused by the body's attempt to rid itself of excess glucose or due to a condition called gastroparesis, where high blood sugar damages nerves that control stomach emptying. You might also experience abdominal pain or discomfort. The combination of nausea, vomiting, and the inability to keep fluids down can quickly lead to a medical emergency, especially in people with diabetes. If you're experiencing persistent nausea and vomiting, especially if accompanied by other symptoms of high blood sugar, seek immediate medical attention. 10. Fruity-smelling breath. A fruity or sweet odor on the breath, often described as smelling like nail polish remover or overripe fruit, is a telltale sign of very high blood sugar. This distinct smell is caused by the presence of ketones in your body. When your cells can't use glucose for energy, your body starts breaking down fat for fuel, producing ketones as a byproduct. These ketones are excreted through your breath, urine, and sweat. The fruity breath odor, known as acetone breath, is particularly associated with a dangerous condition called diabetic ketoacidosis, DKA. This smell might be noticeable to others before you're aware of it yourself. It's important to note that this symptom typically occurs when blood sugar levels are extremely high and requires immediate medical attention. Regular dental hygiene won't eliminate this odor as it's coming from your bloodstream, not your mouth. 11. Rapid heartbeat. High blood sugar can cause your heart to beat faster than normal, a condition known as tachycardia. This occurs because elevated glucose levels can affect your body's electrolyte balance and stimulate the sympathetic nervous system, which controls your fight or flight response. You might notice your heart racing or pounding, even when you're at rest. This rapid heartbeat can be accompanied by palpitations or a fluttering sensation in your chest. It may cause you to feel anxious or short of breath. In some cases, the increased heart rate is a response to dehydration caused by excessive urination. Persistent tachycardia can be taxing on your heart and may increase the risk of cardiovascular problems over time. If you're experiencing a consistently rapid heartbeat, especially in combination with other symptoms of high blood sugar, it's crucial to seek medical evaluation promptly. 12. Difficulty concentrating. High blood sugar can significantly impact cognitive function, leading to confusion and difficulty concentrating. This occurs because glucose is the primary fuel for brain cells, and when levels are too high, it disrupts normal brain function. You might find it hard to focus on tasks, forget things more easily, or feel mentally foggy. Decision-making may become challenging, and you could experience mood swings or irritability. In severe cases, this can progress to disorientation or even an altered mental state. This cognitive impairment can be particularly dangerous if it occurs while driving or operating machinery. It's important to note that these symptoms can occur gradually and may be mistaken for stress or lack of sleep. 13. Abdominal pain. Abdominal pain associated with high blood sugar can range from mild discomfort to severe pain. It may be caused by several factors related to elevated glucose levels. One common cause is gastroparesis, where high blood sugar damages the nerves controlling stomach muscles, leading to slow digestion and bloating. The pain might be concentrated in the upper abdomen and accompanied by nausea or vomiting. In some cases, abdominal pain can be a sign of a more serious condition like diabetic ketoacidosis, especially if it's severe and accompanied by other symptoms. You might also experience cramping or a general feeling of fullness. Persistent high blood sugar can also increase the risk of developing gallbladder disease or pancreatitis, both of which can cause abdominal pain. 14. Shortness of breath. Shortness of breath, or dyspnea, can be a concerning symptom of high blood sugar. This occurs for several reasons. First, when your body breaks down fat for energy due to a lack of glucose utilization, it produces ketones. High levels of ketones can make your blood more acidic, causing your breathing to become rapid and shallow as your body tries to eliminate the acid through respiration. High blood sugar can also lead to fluid buildup in the lungs, making breathing harder. You might feel winded after minimal exertion or even at rest. This breathlessness can be accompanied by a feeling of tightness in the chest. In severe cases, it can progress to Kussmaul breathing, a deep and labored breathing pattern associated with diabetic ketoacidosis. If you're experiencing unexplained shortness of breath, especially if it's sudden or severe, seek immediate medical attention, as it could indicate a serious complication of high blood sugar. 15. Numbness in hands and feet. Numbness or tingling sensations in the hands or feet, also known as peripheral neuropathy, can be a sign of long-term high blood sugar. Elevated glucose levels can damage the small blood vessels that supply oxygen and nutrients to your nerves, particularly in the extremities. This damage can cause a range of sensations, from mild tingling or pins and needles to complete numbness. You might also experience burning pain or increased sensitivity to touch. These symptoms often start in the toes, gradually moving up the feet and legs, and can also affect the hands and arms. The numbness can be particularly dangerous as it may prevent you from feeling injuries or temperature changes, increasing the risk of unnoticed wounds or burns. If left untreated, severe neuropathy can lead to foot ulcers and even amputation in extreme cases. Regular foot checks and prompt medical attention for any unusual sensations are crucial for preventing complications. To conclude our video, let's recap the importance of recognizing these 15 alarming signs of high blood sugar. Early detection can make a significant difference in managing your health and preventing serious complications. Remember, if you experience any of these symptoms, especially in combination, it's crucial to consult a healthcare professional promptly. Thanks for watching, friends. If you found this video helpful, please hit that like button and subscribe to our channel for more health insights. Don't forget to share with someone who might benefit from this information. Stay healthy, and we'll see you in the next video.